and welcome to Subject to Interpretation, a podcast which brings us deep into the topics that matter to professional interpreters. I'm your host, Maria Ceballos-Wallis, and today we have the pleasure of interviewing Dr. Tatiana González-Estarri. She joins us to explore the De la Mora Institute of Interpretation's upcoming series of comprehensive medical webinars. Welcome.
Hi, thank you, Maria. Thank you for having me.
And to give you some background on Dr. González-Cestari's history, she has a PhD. She's also a CHI Spanish, and she has over 2 decades of expertise in pharmacy, pharmacology, research education, and remote interpreting. She serves as the Director of Language Service Advocacy at Marty by Cloudbreak and contributes to the NCIHC Policy, Education, and Research Committee. We're so happy to have you here today.
Thank you. I'm excited. Very honored too.
Well, tell us about your medical background and how you made the leap from being a medical professional to interpreter trainer.
Yes. So as you mentioned earlier, my background is in pharmacy and pharmacology. That means healthcare, very medical, very research focused. But there was a time when I was doing research and certain things happen. You know, you think you have a plan for your life, right? But things happen and then things change abruptly. And that's exactly what happened back then. And as I was looking for a different job or maybe something temporary, well, I decided what to do in research, like what my next step will be in research. I found medical interpreting. So I joined back then also Marty as a video medical interpreter. I took the trainings and all that because I had the medical background, but not the interpreting background. And I always had that passion for languages and cultures as well, but I had no idea about the interpreting world. So that's how I transitioned to that position. And as I was interpreting, I also not only realized the service I was providing and the relief I saw in the patients when they heard someone speaking their language and finally understanding what was happening with their health. That really not only touched me, but filled me a lot. And then the other part of that or side of that I really enjoyed was the fact that I was exposed to 20, 25 different types of medical sessions or healthcare related sessions that helped me grow also as a professional and as an instructor, because back then I was teaching pharmacology and physiology and anatomy in multiple programs in colleges and universities here in the US. So I was seeing that clinical side of things that I wasn't as exposed to. And now I could bring that to the classroom, and I consider, an improvement in my lessons when I was teaching as well. So it was great. And what started as something temporary ended up being something so far permanent because I've been in this for a little bit over 12 years now.
That's wonderful. Tatiana, I think my listeners and viewers would be disappointed if I didn't ask you about, in terms of your background, your language background. You're originally from Venezuela, is that correct?
Yes, I am. Mm-hmm.
And so your formative years, were they spent in the United States or were they spent in Venezuela or both?
Mainly in Venezuela. I graduated with my pharmacy degree and my PhD in pharmacology from Universidad Central de Venezuela in Caracas. But part of my dissertation work, and I have a special diploma from Ohio State University where I did all of my research. So officially, both degrees are from Venezuela, but I did have some sort of mix. As a visiting scholar, I was part of the team at Ohio State University.
Well, I love that you said that you didn't know a lot about interpreting, even though you obviously had a medical background. And now that you've explained your background in, your studies with language, you're clearly fluent in both languages. But I'm so glad that you mentioned that, just because you're fluent in both languages doesn't necessarily make you an interpreter, right?
Correct. Yes, for sure. It's a completely different set of skills that you have to develop.
And so you trained to become an interpreter in addition to, I guess, expanding your knowledge base of medical interpreting as you moved into it, right?
Correct. Yeah, that's true. Mhm.
Well, that's great to know. I always like to point that out. It's important because a lot of people think, just because you have two hands doesn't mean you can be a concert pianist. You might be, but it just doesn't mean that you do. So that's important to remind people of that. And what prompted you to then want to start sharing your knowledge and expertise with other interpreters?
Well, as I was gaining knowledge and skills and all that, I noticed that, um, of course, many of us didn't have the same background. Training for interpreters was not as standardized and still not fully standardized as it is, for example, if you go to, um, if you want to be a doctor or a nurse and you enroll in a nursing program, overall, those programs are standardized. Right now, that's not yet the case for interpreting. There are some colleges and universities that have some of that, but there are no specific requirements, at least for healthcare interpreting in the whole United States, that will tell a hospital or a language service company, oh, this person comes with this background already, like, or these type of studies already. So as I learn more about the industry and the training and the qualifications interpreters needed to have, I saw an opportunity to help and apply the things that I had learned before and my skills as an instructor and a professor or someone who can help lead and guide an interpreter to the next level. So that's how I started also teaching and developing content in different areas. Some are more skill based, and some others are more like terminology and knowledge based, so that interpreters can take advantage of that and grow.
And in what ways is it rewarding for you personally?
Oh, in many ways. In many ways. I'm all about empowering others. I noticed that as I was going through graduate school, my team was first, and I always say, if you make them shine, you shine as well. So I always do that. I tend to just want to help people grow, be independent, empower them, and in interpreting, I'm all about communicative autonomy. So if I'm able to do that, then I'm happy. So it's I guess that part of service in me or what I want to deliver for others.
Well, let's talk a little bit then about this program, this medical membership program that De La Mora has put together. And it's a specialized program for medical interpreters that offers access to online medical webinars, which are going to be live and are, of course, designed to enhance the skills and knowledge of medical interpreters. So, what are the benefits of the membership?
Well, in general terms, you can have access to all of this content. I know there are packets put together for the members, and that's very convenient because you can have access to, let's say, all four trainings for a more convenient price, of course. But if you're not available or you cannot or you don't want to take all four, there's also the flexibility of choosing just one or two. But in general terms, I think uh, we put together a fairly good group of trainings that will help any interpreter at any level with any type of experience. So I'm excited about that.
And giving that the usual question or the first question out of interpreter's mouth is, am I going to get CEUs? Is that something that will be available to them?
Yes, yes, for sure.
Excellent. So let's talk about the webinar series itself. When will it be held? And let's talk about the topics. That's the most interesting part, I think.
Of course, yes. So we're going to start at the end of August, and we have one webinar per month. So we have August, September, October, and November. And we're going to start with some of the skill-based type of topics. The first one is remote interpreting in healthcare, key skills and protocols. And that, as the title says, it's to discuss some of the skills, especially the ones that are key in remote interpreting in healthcare, which are some that we share with on-site interpreting, but they're very critical for remote interpreting as well. Then we're going to, in the month of September, we're going to talk about addressing communication breakdowns due to cultural misunderstandings. This one, we added it to the healthcare interpreting package, but in reality, it applies to any modality, especially, let's say, any modality in community interpreting. It could be educational, social services, healthcare, but we're going to try to dissect out and discuss what to do when communication is not flowing, things are not working the way they should, and the interpreter may or may not need to do something about it in order to reestablish that flow and manage the situation, especially if there are cultural misunderstandings that are causing any problems during the conversation. So
well, before you continue on to the next one, I just think it's important to address this topic. And of course, there are always differences of opinion in what advocacy means, what advocacy is, what interventions are, what's a practical intervention or interjection versus what, how does it become advocacy, and who do we advocate for, if we advocate for anyone at all in medical or community interpreting. So I think this is going to be a really, really important session, I think, across the board for everyone, because what we're really talking about is, going back to your original comment about communicative autonomy, is how do we ensure that we provide a service as interpreters that allows that end user and end user and any of the parties in the encounter to actually participate to the fullest extent without having us interfere in the actual outcome, but for us to assist them in having that full participation, which is, of course, the communicative autonomy and their rights,
right.
according to civil rights law and all, and ADA and all these other civil rights that have been defined in some of the different codes.
Right. Yeah. And beyond all that, all the, federal regulations and all that kind of stuff and standards, is thinking, would this person, either party, have someone there, if they both spoke the same language or they share the same language, would they have someone else to do this for them? Or would you have someone interject or interrupt the conversation to do this for them? So those are the kind of things we are going to discuss. And I will challenge the audience to pause and really think about their actions and how their actions affect that communicative autonomy, because it may hinder it or it may support it. So those are the kind of things I'm very looking forward to discuss with the audience. And of course, I accept the challenge as well, because none of these things are black or white. There's no right or wrong necessarily in every circumstance. So I'm excited too.
Absolutely. I love that. I love that. And let's talk about the next two sessions.
So the next two are more focused on medical terminology and knowledge. And I already provided some training on how to interpret medications, or sessions that include medications, which are almost all of the medical sessions. And we already covered some of those in the past. So you may have access to that already. But so this is a little more in depth. The one in October is called Proactive Approaches in Psychoactive Scenarios. And that's basically diving a little into what type of psychoactive drugs are included in these sessions, the different types of psychoactive drugs, how they work a little bit, and the implications of interpreting for someone who's using psychoactive drugs, or when you're actually interpreting, what kind of words you need to pay attention to and be more focused on, because of course, as you know, any slight changes or any, word choices may be making a big difference into what the patient outcome will be. So that is. Mhm.
I'm sorry, I didn't mean to interrupt, but I just got a little excited there. The reason is that, I work in court primarily these days, although I am CHI Spanish. And it's, these things come up all the time in court. Competency hearings, they come up in terms of, anything when we're talking about, what medications someone is taking, whether someone needs to have an evaluation or has had an evaluation. All of these things come up all the time. And I think that this would be an extremely useful webinar for not just a medical interpreter, but essentially for anyone who has to work in schools where there may be discussions of an IEP and a child that's medicated or not medicated, and anybody in any of these settings. Do you agree?
Right. Yes, absolutely. And it's not just like, oh, the person, let's say, use an illicit drug. No, it could be a medication, something that the person needs to take. Let me just put it this way, even if it's under the influence of alcohol or coffee, too much coffee. Those are different psychoactive drugs that we don't think about sometimes. So yes, absolutely. We'll have some good conversations, and pretty much any interpreter that deals with this scenario is more than welcome to join.
Right, great. And what about the last one? I believe it's about diabetes, and diabetes is, unfortunately, I don't know the statistics specifically, but I do know that it is one of the the most prevalent diseases, especially among Hispanics and African Americans, but it may also be also a disease that is just rampant in the general population as well, if I'm correct.
That's right. Yes. And this is one of my favorites. We're going to, in this one, which is titled Pancreatic Hormones and Introduction to Diabetes Mellitus Treatment, we're going to talk a little bit about the pancreas and how the hormones are created, and then what's the typical balance, what's typical for the body, how the body behaves when things are normal, but then what happens when things get out of balance and then the person develops diabetes, and a little bit about what treatments or category of treatments are available out there that can help bring that situation to where it needs to be. So we'll talk a little bit about the mechanism of action of those type of drugs, and again, some of the key things that interpreters need to be paying attention to when interpreting in these scenarios, so that they make sure if there's something there that they may need to intervene for, they know now and they're ready for that. Okay, so, and I don't think I mentioned earlier, but this last one is going to be at the end of November, and all of the sessions are 2 hours, so that people can plan ahead.
Excellent. Now, speaking of diabetes, I mean, it's a word that we hear a lot, and there's a lot of different variations that we hear, and maybe we don't pay attention to what they are. There's adult onset, there's childhood, there's diabetes type 1, there's diabetes type 2 diabetes. Where does diabetes mellitus fall in?
Well, diabetes mellitus is one of the different types of diabetes. Even So diabetes mellitus has to do with that increase in glucose levels in the blood that are sustained. But there's also the word diabetes per se. It's almost like it means like frequent urination. So it doesn't have that word has nothing to do with sugar levels or glucose or anything like that. Now the mellitus part of that is what gives you the whole picture. Oh, this type of diabetes is accompanied by an increase in blood. Oh,
Blood sugar.
blood is sugar and blood. That's what I'm trying to say. um, but there's also diabetes insipidus, which is just an increase in frequency of urination, but it's not accompanied by an increase in blood sugar levels. And then within diabetes mellitus, then you have the type 1, the type 2, the one during pregnancy, etc. So those are the categories under diabetes mellitus.
Well, you've just taught us more than, you've just taught us a little more than we started with. Thank you. So I think that definitely that will also be a very, very useful webinar. In addition to it being important for interpreting purposes, I think in general in life, having a little more understanding of what our national health crisis are, what's going on with those is also important.
Yes, absolutely. And if I may, I encourage participants to participate and to also make these sessions as dynamic as possible. I always love to have an exchange of ideas and comments and questions and all that, not just me talking. So come prepared to dialogue, to ask questions, to challenge me as well. I'm all about that. So that way I also grow.
Now, I think it's clear that while this is a medical track, it'll definitely be of benefit to interpreters across the board, educational, legal, community, conference interpreters even, who might actually work on some specific conferences that might have to do with these topics. But are there any specific qualifications that are required, such as a medical certification for interpreters to join in these webinars?
Not really, because these topics, any person may want or may need to grow in their knowledge and skills of any of these topics. So you may be working as an interpreter for 20 years already, but there are certain things you may need to tweak, to learn, and to grow. So I will tell you, I've been a pharmacist for more than 20 years. And every time I prepare a class, even if I've taught pancreatic hormones for more than 15 years, there's always something new or different that I'm learning as I prepare the classes. So anyone with any level, any specialization, as you were mentioning, it's more than welcome to join.
So you touched on the importance of continuing education for interpreters. In your mind, how does it contribute to them becoming more effective communicators and even interpreters?
Oh, to me, it's crucial. It's critical. You may know how to transfer or how to interpret and convey the message from one language to the other. But it makes a huge difference when you have a little more knowledge into some of these topics. I'll give you one example, and it's actually related to diabetes treatment. So many years ago, I was shadowing an interpreter. So I was just listening to the interpretation. And the nurse asked, "Have you taken your insulin today?" And the interpreter interpreted and used a word. When you say you take, the interpreter used the word like the equivalent of to drink in Spanish. The patient said, "No, why would I do that?" So when the interpreter interpreted that, the nurse understood that the patient had not received the medication. However, when they measured the sugar levels in blood, they were fine. So they were like, "Ooh, what's going on? Are you sure you didn't take it?" So then at that point, the patient said, "I don't drink my insulin. I inject it." And at that point is when the interpreter realized, and the interpreter knew what would like that insulin was delivered as an injectable and not orally taken. But the interpreter didn't realize that that word choice could have ended up in something very deleterious for the patient. So at that point, the interpreter was able to clarify and say that it was based on his word choices that there was this confusion happening. So those little details, just knowing the route of administration of this drug makes a difference, because then you use a specific word that may be more general to talk about those things. Even you don't need to know them all, but instead of maybe did you take versus did you administer? Because if you administer a medication, it could be by mouth, injection, topically applied, or you name it. Okay, so those are just little things that the more you know, the better your rendition will be.
And so, that's a case for continuing education and learning, providing an opportunity for an interpreter to be more precise.
Correct.
And having more and having had an opportunity to think about some of these levels. And I imagine that I have not interpreted in high stake or high pressure scenarios in the medical setting. It's more been, consultations and therapy sessions, things like that. But I imagine that it becomes even more important to be precise the closer you get to these high pressure situations where you're triage or you're in an emergency room, labor. It's paramount to be precise.
Mm-hmm. Absolutely, yes.
Yeah, no one has time. Nobody has time for clarifications at that point, right?
Right. Yeah. I mean, if you need to do it, you do it, but the smoother, the better. Especially for those, emergency situations or when time is of the essence. So definitely.
Well, Dr. Tatiana González-Estarri, thank you so much for sharing these insights into this comprehensive medical webinar series, as well as your background and as well as why we should all be, conversant and knowledgeable in regards to, medical terminology and procedures, which could at any time come up in our interpreting assignments.
Of course. No, thank you for having me. This is very exciting. I am all about learning and sharing knowledge if possible. So I'm very excited about this series.
Well, we look forward to having or hearing great reviews about your webinar series. And for our listeners and viewers, thank you for joining us here on Subject to Interpretation. You can enroll now at Mora Institute.com to seize this opportunity for professional growth and development. Participants will delve into mastering remote interpreting skills, addressing cultural misunderstandings, navigating psychoactive scenarios, and understanding diabetes treatments. So once again, thank you for joining us here at Subject to Interpretation. And as we like to say, never stop learning.